Hi everyone, welcome back to the channel. Oh dear, the joys of technology. I do apologize if you've linked in at 3:30 and unfortunately the stream couldn't go live. I had some technology problems. I think it's the Valentine tech Grinch that was trying to spoil things today. But we're here. Welcome to Askawayhealth Live. I'm your host, Dr. Sylvia. I'm a general practitioner and health educator with Askawayhealth. Welcome to this Valentine's Day episode. I wish you and your friends, family, or if you're by yourself, I wish you happy Valentine. Cheers to you. Well, Valentine's is a special day. Don't forget that we can and should try and share love amongst ourselves. Self-love, love for friends or family. Every day, not just one special day. But if this is the first time we're meeting, I'm pleased to have you here. On this channel, we have videos discussing trending medical health, wellness, and lifestyle topics to educate and help us get the best out of our lives. On the channel, we publish a new video every Thursday evening, and we have our Sunday live streams just as an opportunity to have a 20 minutes, half an hour chat on common health questions, and I hope you can make it a date whenever you can. You can find us on social media on Askawayhealth, Instagram, Facebook, Twitter, and our website is askawayhealth.org, and of course here on our YouTube channel, so you can connect with us in any of these on any of these platforms, on all of them if you want to. That's great. If you haven't done so already, check out the links. I'll place them in the description box below for the video, and please subscribe. Very special thank you and lots of love to our new subscribers over the last couple of weeks. You guys are amazing. Thank you so much for supporting the channel. It's really great to have you on board and growing, helping us grow our Askawayhealth community. So what are we talking about today? Let's dive into that. Thank you so much. Hi, whoever's on the chat, let me say hello. Hello, please drop a comment, say hi or happy Vals. So sorry about for the late start. I wish I could get out a new link, but I probably have to get people to review things. Tech. Okay, so thank you so much for joining. Welcome welcome to the chat today. So we are talking about, we're doing pregnancy stories, and if you've followed the stream for the last couple of weeks, I decided to begin this series because I came across a viral Twitter thread that suggested there was a lot of concern, lots of women feeling that they weren't getting enough support, being prepared properly for some complications that develop in pregnancy. For many women, pregnancy goes very smoothly, but there are some of us who do struggle with different complications. And I thought this was a great opportunity to open a series to discuss some of the common issues that that a woman might encounter. We've talked about breast problems, including breastfeeding or infections in the breast that could happen during pregnancy, soreness in the breast, or issues with breastfeeding after delivery. Last week we talked about injuries to the perineum, the area where the vagina is located, either from cuts that are given during delivery or from tears that could happen. So we talked about that last week. If you want to have a look at those topics, there are links also in the description box, or just scroll through the channel. So that's why we're having this particular series going on at the moment. This week, we're talking about vaginal bleeding after delivery and looking at the worst episodes of vaginal bleeding after delivery. And unfortunately, I had a really great picture to show you guys, but my my software decided not to behave itself today, which is typical. But around the most common causes of death in pregnancy are things like very severe bleeding, infection, high blood pressure, other complications from delivery, from surgical delivery, and unsafe abortion. These are some of the problems that contribute to about 3/4 of the cause of death in pregnancy. So these are really important issues to talk about, and I thought it was useful to have a look at, in particular today, what, as a woman who's pregnant, about to deliver, or a new mom who's just delivered, what do you expect? What kind of bleeding should you expect after you've had your baby? What could lead to abnormal bleeding problems? And we talked about the worst ones. Obviously, the worst ones would be where you have extremely heavy bleeding that could lead to death. We're going to learn about some conditions that can increase the chance that you could develop abnormal bleeding after birth, and then just look a little bit about the treatments that we use as doctors and nurses, other healthcare providers, to treat people who do have severe or even moderate bleeding after they've delivered, and then obviously finish up with some tips at the end. So let's quickly jump into it. I don't want us to spend too much. I don't want to take you away from your Valentine wine and chocolate. So let's be quick into get into things quickly. So after delivery, you expect some degree of vaginal bleeding, whether or not you've had a vaginal birth, a natural vaginal birth, or whether it's been a caesarean section. You will have some degree of vaginal bleeding called Lochia. Lochia is the name. It's a word that describes the mixture of fluid. It's mostly bloody, but it can contain some mucus as well. And it's just bits of the womb, lining of your womb coming away, and some placental tissue coming away as the womb is trying to clean up and return back to normal after birth. So Lochia is normal after birth bleeding. It can carry on for up to 6 weeks, from 3 to 6 weeks, and carries on as your womb heals and returns to normal, essentially. It's simply your body's way of returning back to normal, getting rid of the excess blood. And like I said, the contents are particularly from the area around where your placenta was fixed in the womb. So that area is going to recover, and of course, as it heals, there'll be some bleeding. And the thickness, your womb became thicker while you were pregnant, obviously to support the baby. And some of that lining is shed for the womb to go back to its pre-pregnancy status. So normal lochia changes. First, in the first 3 to 4 days, you get a sort of a red color, dark red color, or quite red color. And you might experience some blood clots as well, and you might get some pain in your tummy, which is from the contraction of your womb. This is not unusual. So having quite dark red blood, in some women bright red blood, and small clots with a little bit of pain is not unusual in the first 3 to 4 days as your body gets rid of this, gets rid of the lochia. From the 4th to 10th days, the discharge, if I can use that term, starts to lighten, becomes more pinky brown. And by the 10th day to, say, the 4th week, you might still have something coming through that's a bit whitish yellow. And this is because your womb is healing. And so the blood vessels are closing together. You're not getting more blood, you're simply getting more of serous fluid just coming through as the tissues that were inflamed during pregnancy and childbirth are recovering. The only time that you might experience a bit of change in your lochia is in the early days when you're breastfeeding. Some women notice that their blood, the discharge might get a bit heavier and redder, because as you breastfeed, it makes your womb contract, and that also releases more blood. So that's not unusual. But so that's the normal. Let's look at what's abnormal. The abnormal bleeding from your after birth is known as postpartum bleeding. That's after pregnancy bleeding. So if you wanted to search that up and read a little bit about it, that's the name: postpartum bleeding or postpartum haemorrhage. So let's look at what happens. It can develop at any point from the time you've had your baby and the placenta has been delivered up to 12 weeks, but it's most common reports are usually within the first 24 hours. We call that primary postpartum bleeding. And anything that is above 500 mils. So if you're looking at in terms of quantity, say sort of half a pint, it's difficult to quantify when you're sort of experiencing it, but that's the volume that doctors use to classify how much bleeding is excessive bleeding. So anything more than 500 mils. And of course, if it's a lot more than that, it can be, that can constitute quite severe bleeding. So although I've said to you that on your first couple of days, you'd expect to have sort of bright red or dark red bleeding that lightens as your time progresses with Lochia. In the case of postpartum bleeding, you might pass large blood clots, so as big as a plum or a guava fruit, or the native cherry, what we call agbalumo, the Yoruba dialect agbalumo in Nigeria. So if you're looking, you're getting clots of that size. That's quite sizable volume clot, and you should be talking to your doctor, your midwife, if you're finding that you're passing large numbers of that size of clot. So you might pass small clots about the size of a small coin or penny, and if you do that a couple of times and you notice that that's slowly going down, that's expected. But if you're passing larger clots often, then that's a flag, that's a sign that so don't just expect it to be all bleeding and just a flow of liquid. Also watch out for the clots. Now, bleed that soaks more than one sanitary towel per hour. Please remember that after birth, you should not wear a tampon. You should be wearing a super absorbent sanitary towel. Because again, what this also does is helps to monitor the quantity of bleeding that you're having. And if you have bleeding that soaks more than one sanitary pad an hour and doesn't slow down or stop, that's another flag. You must be seeking medical attention, going to hospital, ringing an ambulance. Other signs are if you're feeling unwell, you're feeling really ill. So you might feel very, very nauseous, weak, dizzy, feel faint, as if you're going to pass out, or feel trouble with your eyesight, your vision is blurred. You might feel chills, or you might feel that your skin is clammy, moist and wet, and just feeling ill. Your heart rate might be faster, it might be pounding, and really just generally feeling unwell. Please don't, that's not normal, please. That needs to be urgently brought to the attention of your doctor, your midwife, or the people supporting your birth or your care. And this is happening at any point within the first 12 weeks of your delivery. And so what should be happening is you should be immediately assessed. They should will be monitoring the amount of blood loss and then looking for what's going on. Why is this happening? And obviously treating. The bleeding that happens usually after 24 hours is called secondary PPH. And most often we think it happens because of womb infection. And sometimes it happens after women have left the hospital. So those are just different classifications that doctors can sometimes use. But why does abnormal bleeding happen after delivery? What are causes? Now, most of the time, postpartum bleeding happens because the womb is not contracting enough to control the bleeding. Remember that after you've delivered the baby and the placenta comes away from the lining of the womb, there's a large space in the womb that's left that's bleeding. Whether to close off those blood vessels and stop the bleeding. That's the natural event that should occur. And if something interrupts that, prevents that from happening properly or slows it down, then you could develop bleeding, severe bleeding afterwards. Other possible reasons are if parts of the placenta are stuck in the womb. There's sometimes when the placenta itself grows too deeply in the wall or the lining of the womb, but in some cases, not all the placenta comes away freely, and you have some stuck that can contribute towards bleeding. Other reasons could be if there's some kind of trauma or injury to the womb, even the womb bursting or rupturing, as we call it. And in some other cases, there might be a problem with blood clotting. All of us have the mechanism in our bodies where if you sustain a wound or a cut to your body, goes different things, different activities or systems start off in your body to stop the blood from continuing to flow. That's clotting, when it forms that solid seal. In some people, that mechanism does not exist, or there is a defect somewhere. And so if they sustain a cut or if they start bleeding, they're not able to stop. And sometimes this could contribute towards trouble with abnormal bleeding. So Thank you so much, David. That's really helpful. So there's a problem with the link. I completely agree. It was not just the link problem, it was also the software problem. I'm going to look into it. But you're absolutely right. People can join by searching for Askawayhealth on YouTube and click on worst pregnancy bleeding. Thank you so much. So that's really useful. And someone else on the chat, welcome. Happy Valentine's Day to you. Say hi. Don't just sneak. It's good to see you on the stream. So next, let's talk about the conditions where abnormal vaginal bleeding after birth could happen. We've talked about why it could happen, but in which scenarios? So first of all, before you deliver, what possible conditions could increase the risk of it happening? Number one, if you've had it before, it could happen again. So if you've had abnormal post-pregnancy bleeding or abnormal vaginal bleeding after your birth in the previous time, you could have it again. I'm modeling that up, aren't I? What I'm trying to say is that if you've had abnormal bleeding after birth, it is more likely to happen again. And so, of course, we need to make sure that we're doing everything we can to prevent it. And that can include increased monitoring during your antenatal period. So that's something to be aware of. Another thing is having a BMI that is more than 35. So being very overweight is something that could contribute. And don't forget, what we're looking at is factors that could contribute to inability of your womb muscles to contract properly. So having had this before, that might increase the womb's vulnerability. Being overweight can also mean that your muscles are not as healthy as they should be, and that could contribute. Another factor is if you've delivered 4 times or more in the past, and that could contribute towards weakness of your womb muscles, and then make them less likely to contract properly as they should. Next, carrying multiple pregnancies, so carrying twins or triplets, for example, stretches out the womb over that period of time while you're pregnant. And so when it's time for the contraction to close off the blood vessels, when that time comes, it might be difficult for the muscles to do so effectively. Placenta problems, problems with the placenta, I've touched a little bit on that, but also things like having a low-lying placenta, or if the placenta comes away early, can contribute as well to abnormal or heavy bleeding in pregnancy and after birth. Other problems that could link to having heavy bleeding after you've delivered are a high blood pressure, the condition known as preeclampsia. Now, I will talk about this in a future stream. I don't want us to take too much time about it, but please bear that in mind, that your blood pressure needs to be well controlled while you're pregnant, because it could lead to many complications, one of which is problems with heavy bleeding after you've delivered. And another one is anemia, the state where you have low hemoglobin levels. That starting off with low hemoglobin levels before you deliver could increase your risk of having abnormal bleeding. And that is why your midwife, your doctors would make sure with your routine antenatal checks, your blood tests, make sure that your hemoglobin levels are in a satisfactory range before you deliver. Okay, what about in labor? So we've looked at the conditions that could cause abnormal bleeding to happen before your labor, but what about in labor? Now, delivering by caesarean section, obviously there are risks associated with that. There could be risks from the womb not being able to, for example, depends on what the reason for the caesarean section. Sometimes if you have a woman who's been laboring for several hours and then nothing's going on, and then a decision is taken to have a CS, there might be problems with contraction of the muscles at the time that you need the bleeding to stop. But there could also be problems with the delivery. So it could be a surgical problem, something to do with not being able to secure all the blood vessels at surgery for some reason or the other, and then inadvertently a blood vessel is left leaking. That can contribute to bleeding. Another condition is induction of labor, which many women may be familiar with, but induction of labor is simply a situation where your womb contraction during pregnancy is stimulated before labor begins. in order to achieve a vaginal birth. So labor hasn't started, but then you intentionally begin the stimulation of the womb to start labor. And it might be that a number of reasons why you may need to have induction of labor. For example, if your post date approaching 2 weeks past your due date and your labor hasn't started normally, or if there are concerns about an infection in the womb, or some women who are diabetic, or women who have high blood pressure problems. These are examples of women who may have induction of labor. In some cases, it might be elective. But the bottom line, what I'm trying to explain to you is that if you do go through induction of labor, it increases the risk that your womb muscles won't properly contract when you need them to after baby and the placenta have been delivered. And that can lead to serious bleeding problems after delivery. We've talked about the placenta. I did mention episiotomy at the start of the live stream because we talked about that just last week. And I did mention that it's one of the factors that can increase the risk of bleeding, where here you go, back here again. So having a cut given to help or assist your delivery, because that's what an episiotomy is. And please make sure to have a look at that video from last week. I went into a lot of detail, but basically a cut given to help your delivery, there could be complications of bleeding afterwards. Something that's another factor that can increase the risk of abnormal bleeding when you're in labor is if you need to have assisted delivery. So using instruments like a forceps or vacuum. These are instruments that we use to assist the extraction of the baby or bringing the baby out. If, for example, labor is not progressing, mom is tired, or we think that the baby is distressed, there are different reasons why it might happen. A few other conditions could make abnormal bleeding more likely. A woman who has been in labor for several hours, over 12 hours, the muscles will actually get tired, and so they can't. After delivery has happened, they just can't perform that contraction that you need. Another condition is having a big baby. So a baby who weighs more than 4 kilograms, about 9 or 10 pounds, is more likely to have abnormal bleeding. If you have your baby, your first baby, when you're more than 40 years old, that is a risk factor. Studies indicate, I'm not sure of all the reasons, but studies do indicate that in some women may have an increased risk of having postpartum bleeding if having the first baby after age 40 years. Now let's quickly look. So I've described what could result in PPH. I call it PPH because that's just used to it. But what I mean is post-pregnancy bleeding. So PPH, bleeding after childbirth, that's what we're talking about. So we said, how does it happen? We've looked at the conditions in which it could happen. How do we treat it? Now, if it's severe bleeding, the primary thing is to resuscitate, that is, rescue the lady and stop the bleeding. So trying to manage both scenarios at once. So if it's something that's detected within the first 24 hours and you're still in the labor room, your midwife or your doctor might start massaging your abdomen, trying to massage your uterus and trying to get the muscles, stimulate the muscles to contract. Because if they contract, they squeeze on the blood vessels that are bleeding, which is what you need. They could also give you another injection. I'll talk about this in a little bit, but there are medicines that we give you to try to prevent the problem of PPH happening. They could put a catheter, that's a tube that goes into your urinary bladder, to empty the bladder, because it might be that if your bladder is full, that might be preventing your womb from contracting properly. Remember that the bladder is right in front of the womb, and the womb at this stage is a lot bigger than what it is normally. So the pressure of the bladder sitting on it might just prevent the muscles squeezing together as they should. And they could put a drip because, like I said, you want to resuscitate. If somebody is bleeding quite heavily, you need to put fluids back into them. So they'll quickly put a drip, a cannula into your arm to try and get fluids to hold up your blood pressure while they're trying to sort out what's causing this bleeding. Trying to get the muscles of the uterus to squeeze and to contract to stop it. So lots of things could be going on at that time. Did I not say it is an emergency situation, particularly if bleeding is severe? So please, that's why I highlighted at the beginning the signs to watch out for. If you're worried about the amount of bleeding that you're seeing on your sanitary towel, if you're feeling unwell, please ask. Don't just think, oh, they said it will settle down. Don't assume. It's okay to ask and just be sure. Okay. Some women might need oxygen if the bleeding is quite severe and if they're close to losing consciousness because they've bled so much. Apart from trying to rub your tummy, trying to rub and stimulate your womb, they might do, your medical team might carry out something called bimanual compression. And that's where the doctor or the midwife, they put a hand in the vagina, and with the other hand, they're putting pressure, squeezing the uterus in between. Again, he's trying to do the same thing. He's trying to get the muscles to squeeze together to stop the bleeding. Somebody would also be having a good look at the placenta to try and see, is there any bit that's incomplete? Because that tells us that there might be some placenta left in the womb, and that's why the bleeding is going on. And in that case, you might have to go back into theatre so that bit, even if it's that small, is removed to stop the bleeding. And of course, if you had any cuts or if you had any tears, those are inspected carefully to make sure that is not where the bleeding is coming from. So they'll keep an eye on your blood pressure, really key vital signs. Your blood pressure will be monitored, your pulse, your heart rate, your temperature, all these things will be monitored while this is going on. If the bleeding, if they're not able to arrest the bleeding using these measures, there are other medicines, injections that can be given to stop the bleeding, to try to stop the bleeding. In addition to fluids, simple fluids like saline that you might be getting, you might also get a blood transfusion depending on how much bleeding or blood has been lost. And if things just don't seem to be, if nothing's clearer in the labor room, its next stop has to be the operating theatre, so that we can look for what's causing this bleeding. You might need an anesthetic. You might be put to sleep for this purpose, depending on what's going on. And the process that would follow, the doctor has a look. They might want to put what's called a balloon into the womb to put pressure on any bleeding vessels, particularly if it's that the womb the muscles are so lax or so tired and they cannot contract effectively. Putting pressure might help to stop the bleeding vessel. So that's one measure that they might adopt. They might want to carry out a laparotomy, a cut into the abdomen to have a look what's really going on and try and stop the bleeding that way. Occasionally, it might be necessary to have a hysterectomy, which is where the womb is removed. And obviously, this is only if other measures have been adopted and they've not worked. Because what you obviously don't want is loss of life. Many women can bleed to death within hours with severe post-pregnancy bleeding. So it's really, really an important condition. You need to seek medical help as soon as possible. So these are some of the measures that people treating you might take to try and solve the problem. And of course, it varies from one woman to another, but I just wanted to give a broad overview of what potentially could happen. How could we prevent postpartum hemorrhage? Are there things that we could do? Well, medically, and I did reference this just a few minutes ago, if someone has a vaginal birth, they could give an injection. It's called syntocinon. You might have heard that if you've been pregnant before and delivered before. An injection of syntocinon, that drug is to help reduce blood loss. It works on the womb, and you get it just as the baby is being delivered, and it helps the placenta to come away from the wall of, just assists it. It's going to come away, but it assists it to come away and helps the uterus the womb start contracting. Obviously, you're going to be examined carefully for any tears, and the placenta will be examined as well. If you have any tears, the important thing is to try and stitch them, repair them quickly to reduce any chance of bleeding. And if you have a caesarean section, you will also get this drug into your drip while you're having your operation, and the placenta will be removed. Another thing is, if you are breastfeeding, if you choose to breastfeed, you're encouraged to start as soon as possible, because breastfeeding, the action of breastfeeding also releases that hormone, the hormone oxytocin, which also contracts the womb. So these are some measures that we can take to help prevent the development of postpartum bleeding. You saw from the list I shared earlier, there are quite a lot of causes. You can't always prevent them from happening. Sometimes there's not many things that you can do, but sometimes there are. For example, if you become aware that you're anemic, please take it seriously, please, and do whatever it is that you're advised by your clinicians and whatever you can to help to improve your blood levels. It might just be taking a tablet, an iron tablet, making sure you're eating healthy meals, reporting any symptoms of anemia while you're pregnant, feeling very tired or drained, feeling short of breath, pounding headache in your temples, tingling sensation, feeling dizzy or your heart beating very quickly. Discuss these. It's best to have them discussed. And if your doctor or your midwife or your team decides, right, let's go and get a blood test done to check, then fine. If it's normal, no problem. But it's important not to ignore these things, so please be aware. The other thing to do is to treat any high blood pressure. High blood pressure is not normal in pregnancy. It is always something that needs to be addressed. There are many, many complications. One of them is abnormal bleeding. So the important thing is make sure you're taking your prescribed medication, you're resting as you're advised to do, all the steps that you've been advised to take to manage the high blood pressure, really important. Another thing is to maintain a healthy weight before you become pregnant, because one of the things we talked about was that women with BMI over 35 have an increased risk of bleeding after having their baby. So before you do get pregnant, try and maintain a healthy weight, because this would help to reduce the chances of abnormal bleeding. Some drugs, so some studies indicate that women who take antidepressants like SSRIs in their last month of pregnancy may have an increased risk of bleeding after birth. Something that's really important to make sure that your midwife and your doctor know what drugs you're taking, so that you can make sure we're managing things properly. So after birth, we've talked about Lochia. It should be reducing gradually over time. Watch out for activities that could cause bleeding, okay? Especially if you've not fully recovered or healed from any of the things that you've had while you were pregnant, maybe an episiotomy or a cut or a caesarean section. For example, if you want to jump back into getting fit and exercising, please make sure that you're fully recovered. And it can take longer than 6 or 8 weeks, particularly if you've had surgery. It can take longer from the tissues inside to get back to normal. And you might find that if you rush back into cardio or things like that, you might do some injury and cause bleeding to happen. So please watch out for that. Same applies for sexual intercourse, for example, especially if you've had a cut. If it's not healed properly and you start sexual relations, of course, that might probably be quite painful, but you might damage the stitches that you've had and open up your wound and cause bleeding. So that's a lot. I know I've said it very quickly, but I really wanted to get through as much as possible in our little chat today. As I've come to the end, thank you so very much for joining me. I'm just going to have a quick look on the chat to see if we've managed to get any questions. And I see, thank you so much, Dr. Helen from New Platter. Thank you so much for finding me. It was a big snag with technology today, but I think it's the St. Valentine's Day glitch. And hi there to Dental Storm. Happy Valentine's Day back to you. Hope you're having a lovely day. Thank you so much for joining in, and everybody else. Really glad that you made it in today. So I'm going to release you now to go back to your Valentine's Day celebrations and activities. But please don't forget to like the video and subscribe to the channel. And if you were on our Instagram or Twitter pages, you will know that we've been running an Askawayhealth Valentine's Day giveaway. So we're to announce the winners. So some lucky people are going to be going away with some nice gifts, Valentine's gifts. So make sure you join us on Instagram. I think we'll be announcing the winners in the next maybe half an hour or so. So thank you so very much. Don't forget to subscribe. If you have any video topic areas you'd like me to sort of provide a little bit of an in-depth look to, let me know. If you've got any questions on this topic, by all means, send an email, send a direct message on info@askawayhealth.org, and we will be sure to get onto it and provide you with a response. Okay, my dears. So make sure you have a great week, and hopefully see you next Sunday with all our tech issues smoothened out for a fantastic stream as usual. Take care, guys. Bye.